Well, my job is to close these 2 days, and the first thing I will promise you is I will not try to summarize what was said. And Lynn and Linda both mentioned that the Roundtable is an occasion for conversation in which we learn, but it is not an occasion to try to develop a consensus document. So the character and the quality of the conversation is really important. And I think we were very lucky, because I think we had a very high-quality conversation. And for that, I want to thank, first of all, the planning committee that put this program together. There's a lot of thought that went into this, and I want to thank them. And secondly, I want to thank Kathleen and Aaron for really pulling it off and putting this program together, and we are all in your debt. I felt very good at the beginning of this session because if I understood the early conversations, it was that the issue of overweight and extra poundage is really a product of your parents and your mother and your prenatal time. It's not my fault. So I was very pleased with that until, first of all, Linda said I don't get a pass on eating too much or on exercise. And then I really felt bad when Barbara Corky said that I shouldn't listen to anybody here anyway because they're all misleading me. It was a downer for a moment. Did I quote you incorrectly? Well, all right, maybe I took that a little too literally. Maybe you meant it too literally. No, but I did actually learn something here, and I will just mention a couple things that I think are useful. Firstly, obesity has grown, and there's no question about that. So we are dealing with something of an epidemic, if you will. Whatever we know about the causes, we know from statistics that I think are quite reliable that it's sort of doubled from the late 70s to the early part of this century. So we're dealing with a health problem of some magnitude. And the second thing I did learn is that the accent on nutrition and on physical activity absolutely has to continue, but it absolutely does not cover the field. And much of this part that we talked about in the last 2 days are things that I, for one, didn't know, and that I think a large part of the public doesn't know. We have to remember how differently we live from, let's say, 50 years ago. And Mr. Dietz pointed that out, that we eat differently and we move differently. We didn't have the screens that everybody has today that leave us sitting or standing in our place and not moving. And so these environmental concerns, using environmental in a very broad sense, are an important part that we have to remember or probably part of the cause of our problem. It was said that weight control is an endocrine issue, and therefore we ought to focus on endocrine disruptors, and I think a large number of the presenters did exactly that, and particularly helpfully. And one way that somebody put it that stuck with me was when he said we have to focus on chemical impacts that make someone more susceptible to weight gain. Now, you know, all of you probably have had that idea in your mind, but I didn't have that idea in my mind when I thought about the problem of obesity in our society. And the notion that the chemical impacts that make someone more susceptible seems to me to be a large part of what we talked about. I did note the phrase that we have to be careful not to dig a hole in water. And there is a little bit of that problem. That is, as we solve something here, the hole gets filled up with another chemical or another food, so we have to keep that in mind. That is seems to be a law of nature. When somebody said that obesity is an infectious disease, I think Mr. Durander put it that way, and that was kind of a challenging proposition. It leads to suggestions that, as he pointed out, that maybe you try to find a vaccine. Well, I mean, I'm not sure I buy that at the moment, but I do think that thinking of it as an infectious disease is interesting. And when he put up all those maps that showed that the spread of obesity parallels the spread in our country of infectious diseases, I didn't know what to make of that, actually, but it does. What it told me is that you have to be open to suggestions of causation that we weren't open to before this session. At least I wasn't. I think one practical note, I think as a health community, we have to be careful that when we go for funding for some of our projects, we can't always have a proof of concept, but we have to be able to define a proof of concept. We have to, it seems to me, if we're going to ask to focus on various ways to deal with obesity, we have to have sort of a pathway to success, at least that we can present and that we can defend. Because there's a competition for funds, there's a competition for attention, there's a competition for making things priority, and I think that is a challenge that this community has, like others, but the conversation of the last 2 days certainly underlined that. The last point I would just make is, I really did make it earlier in my other intervention, is TSCA reform. As a health community, there are not going to be many bigger issues for the health community or for the American society in the area of health than the effort to reform TSCA. It hasn't been reformed in 40 years or something like that, a long time. It's going to be an imperfect bill. It's almost guaranteed. Well, strike the almost. It is guaranteed. And we are, as a community, are going to have to make a very important choice as to whether to back it or to damn it as being simply inadequate. And we'll have to see what it looks like before we make that decision. But it is surely going to be upon us. With that, I don't have any more things to say except bon voyage, and I hope that very few of your airplanes get canceled. Linda, do you want to say something? Linda, thank you for playing host to this event. This is an impressive institution. I felt that before I saw it, and I feel it even more so now. And we're very grateful that you hosted this event, and we hope that we contributed something to the cause that we're all working on. Thank you.